Number 7. Nurses. Nursing grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who is still in training; a staff nurse, a nurse who has completed the trainer course; charge nurse, a more experienced nurse who is in charge of responsibility for a ward or department; nurse managers, a nurse who is in charge of several wards. Note: the other sisters are still something used for a female child nurse. A female nurse manager may be called matron. Dr. Jens is thanked to Sister Waskin. Support workers. The clinical support workers who has done a short course and obtained basic qualification and the nursing auxiliary is usually unqualified, both assistant nursing staff. There many also be workload whose duty include making sure patient, nurse, and information are up to date and answer the telephone. Specializations. Like doctors, this kind of specialists. A midwife has especially for the beginning by done a course in midwifery, the management of pregnant and childbirth. District nurses visit patients in the homes, help visitors, also work in the community, giving advice on the protection of health and the prevention of illness. The nurse's role. The nurse's role has changed considerably recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressing, giving injections, and removing sutures, nurses now do some of the things previously reserved to doctors, such as prescribe drugs and ordinary laboratory tests. More responsible for nurse is planner, as the following article demonstrates. Nurses carry out just surgery in effort to cut patient wait lists. Nurses in Scotland trained to perform minor surgery have interdicted the operation there of the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Global Caledonian University are not qualified to carry out such pressure as the removal of a small lesion began molars and cries. The verbs perform and carry out are used with or types of pressure. They are often used in the patient form. Perform an examination, an operation, and procedures. Carry out an experiment, a test, a biopsy. The production was performed carried out by a nurse. Complete the sentences. Look at A, B, and C option to help you. Number 1. Someone who specializes in delivering babies is a midwife. 2. Someone who is qualified to assist nursing is a clinical support worker. 3. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. A nurse who has qualified is a district nurse. 5. A nurse who specializes in health promotion is health visitors. 6. A nurse who looks after a ward in management nurse. 7. A nurse who works in community is a visitor nurse. 8. Someone who asks where the ward telephone is a ward clerk. Make word combination, use word, or files for the is boss. Look at the option to help you. Carry out a procedures, change at the same, check a temperature, give an injection, and remove acceptors. Complete the sentences with the correct grammar for the perform. Number 1. An isotope brain scan of plainness and easy and predators. 2. Biopsy of the pancreas of examination last March. 3. If the patient is condition deteriorated, it laboratory should produce. 4. If a diagnostic or meaning in subjects a lumbar punctures are operation. 5. Last year we had examination a randomization double-blind group study. Complete the synthesis with the correct grammarly from of carry out. Number 1, I know intent experiment social study. 2, unfortunately few brutally controls a biopsy. 4. 3. A number of studies attest recently to look at this question. 4. A right hemicolitologist an operation and the patient made full recovery. 5. This producer can test in the emerging department.